Did you know? 1 in 3 people will develop cancer in their lifetime. It's a staggering statistic, but what's even more alarming is how many cases are diagnosed too late because the early warning signs are missed. Early detection can be a game changer. According to the American Cancer Society, identifying cancer in its early stages, such as stage 1, can result in survival rates of over 90% for many common cancers. However, if the diagnosis comes later, such as at stage 4, those survival rates can drop dramatically to below 20%. The key to catching cancer early lies in recognizing the subtle warning signs your body may be sending. Unfortunately, most people either don't notice these signs or dismiss them as minor, everyday issues. But ignoring these quiet signals can have serious consequences. In this video, we will walk you through 8 warning signs that could literally save your life. These aren't the obvious symptoms like lumps or dramatic weight loss. They're subtle, quiet, and easy to overlook. The goal is not to alarm you, but to empower you with knowledge. Many people hesitate to address symptoms because they worry about overreacting or being labeled a hypochondriac. But when it comes to your health, it's always better to err on the side of caution. We will delve into scientific research, not internet rumors, and focuses on symptoms that have helped thousands of individuals detect cancer early when treatment is most effective. So let's dive deeper into these warning signs. Just a quick reminder, we are not medical doctors. This video is for informational purposes only. Number 1. Persistent bone pain. Bone pain is often dismissed as a normal part of aging, a side effect of exercise, or a minor injury. However, when bone pain persists or worsens over time, especially at night, it can be a sign of cancer, particularly if it originates in or spreads to the bones. Cancer-related bone pain often starts subtly, resembling the ache of a sprain or muscle soreness, but gradually becomes more intense. Primary bone cancer, such as osteosarcoma, typically affects the long bones in the arms and legs. The pain can interfere with daily activities, making even simple movements challenging. Look for accompanying symptoms such as swelling, tenderness, or unexplained fractures. These can indicate that the bone structure is being compromised. Early detection is crucial. When bone cancer is identified in its initial stages, treatment is far more effective. If you're experiencing persistent bone pain that doesn't respond to typical remedies, consult a healthcare provider promptly. Number 2. Eye pain or vision changes. Your eyes are more than windows to your soul. They can reveal critical clues about your health. While blurry vision or eye strain is common, persistent symptoms could point to something more serious, like ocular melanoma, the most common primary eye cancer in adults. This type of cancer may present as blurred vision that doesn't improve with new prescriptions, unexplained flashes of light, or a dark spot on the iris that gradually changes in size or color. These symptoms often develop subtly, making them easy to dismiss. Fair-skinned individuals and those with light-colored eyes are at higher risk. Regular eye exams are essential, particularly if you have prolonged sun exposure or a family history of eye cancer. Early intervention can save your vision and, potentially, your life. Number 3. Unusual skin rashes or spots. Skin changes are common, but certain rashes or spots demand attention. For instance, leukemia. A cancer of the blood and bone marrow can manifest through skin symptoms such as petechiae. These small, round red or purple spots result from a deficiency in platelets, which help blood clot. Petechiae often appear in clusters, especially in areas of pressure, like around the ankles or beneath tight clothing. Unlike typical rashes, they don't itch or fade with time. They may also be accompanied by unexplained bruising or prolonged bleeding from minor cuts. Recognizing these signs early can lead to a quicker diagnosis and improved treatment outcomes. If you notice unusual skin changes that persist, seek medical evaluation. Number 4. Changes to your fingernails. Your nails can also reveal signs of underlying health issues, including cancer. Subungual melanoma, a form of skin cancer that develops beneath the nails, often starts as a dark streak running vertically along the nail. Unlike common nail discoloration, cancerous streaks tend to appear suddenly, grow wider, and may have uneven or blurred borders. They can also cause pain, nail splitting, or bleeding. A key warning sign is the Hutchinson's sign, where the pigmentation extends beyond the nail onto the surrounding skin. Subungual melanoma is often mistaken for nail trauma or a fungal infection, but early detection is critical. If you notice persistent changes to your nails, consult a healthcare provider. If you're finding this information helpful, please hit the like button, subscribe, and turn all notifications on to stay updated with our latest health and nutrition tips. Number 5. Drenching night sweats. Occasional sweating during sleep is normal, especially in warm environments or during times of stress. However, repeated episodes of soaking night sweats where your bedding and clothes are drenched could indicate lymphoma. These night sweats often occur alongside fever, unexplained weight loss, or fatigue. The body's immune response to lymphoma produces inflammatory chemicals that can disrupt its ability to regulate temperature. If you experience persistent or severe night sweats, especially with other symptoms, consult a doctor. Identifying lymphoma early can significantly improve treatment outcomes. Number 6. Persistent heartburn. Chronic heartburn or gastroesophageal reflux disease may seem like a minor inconvenience, but if it persists despite lifestyle changes or medication, it could signal esophageal cancer. Heartburn occurs when stomach acid damages the lining of the esophagus. Over time, this can lead to Barrett's esophagus, a precancerous condition. Warning signs to watch for include difficulty swallowing, food feeling stuck in your throat, and unexplained weight loss. If you've been self-treating heartburn for more than 3 weeks without improvement, seek medical advice for further evaluation. Number 7. Sudden jaundice. Jaundice, characterized by yellowing of the skin and eyes, occurs when bilirubin builds up in the bloodstream. While it can result from various conditions, its sudden appearance in adults may indicate pancreatic or liver cancer. Tumors in the pancreas can block the bile duct, causing bilirubin to accumulate. This often results in yellowing skin, dark urine, light-colored stools, and itching. Since pancreatic cancer is difficult to detect in its early stages, recognizing jaundice early can make a significant difference. Seek medical attention immediately if you notice these symptoms. Number 8. Persistent fever. Frequent or unexplained fevers can be an early warning sign of blood cancers like leukemia or lymphoma. Unlike typical fevers caused by infections, cancer-related fevers often recur or persist without a clear cause. These fevers may follow a cyclical pattern, occurring at regular intervals, and are often accompanied by night sweats or weight loss. Blood cancers can weaken the immune system, making the body more susceptible to infections while also triggering fevers directly. If you experience prolonged or recurring fevers that don't resolve within 2 weeks, consult a healthcare provider. Blood tests can help identify abnormalities and lead to an early diagnosis. Take action. While these signs don't necessarily mean you have cancer, they should never be ignored. Early detection dramatically improves treatment outcomes and can save lives. If you or someone you know is experiencing any of these symptoms, don't hesitate to seek medical attention. Share this information with friends and family. It could make a life-saving difference. Don't forget to subscribe for more health-related content and take charge of your well-being today. Remember, knowledge is power, and in this case, it could save your life. Keep in mind that we are not medical doctors, and this information should not be considered medical advice. This video is for informational purposes only. It is always best to check with your doctor for medical advice and treatment. They will know more about your individual condition. Remember to check out our other videos on this channel. Thank you for tuning in. Until next time on Health Info Hub, stay informed, share your thoughts, and subscribe.